Hello, and welcome to the 4900 Capstone Project for Nursing Intervention presentation in Capstone Video Reflection. My name is Elena Rumble, and I'll be discussing the hypertension intervention presentation I gave to my patient, Mr. Williamson, as well as reflecting on my RN to BSN experience at Capella. I drew information from my charts with Mr. Williamson about his diagnosis of hypertension and strategies he might take to better control it outside the conventional medicine treatments while creating an intervention. Mr. Williamson, a friend of my family, was first contacted by phone to see if he could schedule a meeting to explore whether he would be interested in participating in my project. He said yes. Tuesday, November 2nd, Thursday, November 4th, Wednesday, November 10th, and Saturday, November 20th, which was yesterday, were the dates we agreed to meet at his place. Each meeting lasted around 2 hours, except for yesterday, which lasted almost 3 hours, for a total of 9 hours. We addressed the ins and outs of his diagnosis, medicines, stresses, and other elements that contributed to his blood pressure during his first meeting, which took place on Tuesday, November 2nd. During this discussion, it became clear that his stress level is a primary factor in raising his blood pressure and negatively affecting its control. We discussed the causes of stress and what might be done to alleviate it. Mr. Williamson mentioned that he's quite stressed because of his job, which have a negative impact on his sleep routine and lead him to be fatigued most of the time. He also works in a very short-staffed environment, so he sometimes needs to do the job for 2 or 3 people. Mr. Williamson works as a housekeeping supervisor on a night shift at a medical facility. His hours are 7 p.m. to 5:30 a.m., Monday to Friday. And since he is the supervisor, he also works most weekends for around 5 hours on Saturdays and Sundays. He has lost workers and he is short-staffed because of the pandemic. Therefore, he must do the task of 2 or more people. On occasion, he is required to drive to separate buildings to assist there as well. He forgets to take his meds since he works at night and he's overtired. He sleeps in the morning and early afternoon, and he's busy at work at night. When asked about his diet and exercise, Mr. Williamson said that before the staffing concerns, he used to go to the gym almost every day, and now he has stopped exercising and he's gaining weight. He's also struggled with diets since he's enjoying eating. He claims that he attempted the keto diet before and failed because he loves his carbohydrates too much. His meals are extremely seasoned and heavy in salt and cholesterol due to his African American ancestry, and he never considered how this might affect his blood pressure. It was clear from this interview that several of the research-based risk factors were hurting Mr. Williamson's health, and that evidence-based practice was not being followed. When I was formulating evidence-based practice interventions, I was able to look back at our conversations and use his words to build a plan he could follow and refer to it as required. As a response to his strenuous job, I added simple techniques for him to manage his stress, such as breathing, exercising, appropriate sleep, relaxing with some time alone, and asking for help. The usage of day of the week pill boxes, establishing a time for each dose of medication and taking them at the same time every day, and putting reminders on his phone through an alarm or application were all used to improve medication adherence. We went over the DASH diet with him, which is the most successful hypertension diet. The diet is high in fiber and protein, low in sodium, and heavy in fruits, vegetables, and whole grains. People can also consume fat-free or low-fat dairy products, fish, poultry, beans, and nuts on this diet. The DASH diet is ideal for Mr. Williamson because, unlike the keto diet he attempted earlier, it does not fully remove a food category. I use resources from evidence-based practices and considerable studies on hypertension to build the intervention strategy. Most of the materials came from the CDC, the American Heart Association, Million Hearts, and cardiology periodicals located in Capella's library and on Google Scholar. To guarantee that the material was current, they were all published within the last 5 years. The sources are well known and trustworthy, and they provided me with relevant knowledge that I could use to create interventions for Mr. Williamson. In healthcare, technology is frequently employed. Most people think of computers and charting systems when they think of technology in healthcare, yet technology is everywhere. Technology, for example, is used to reduce stress through the usage of internet resources. Technology may be used to improve communication, increase knowledge, and manage hypertension. The pamphlet prepared for Mr. Williamson is another example of technology being used to improve communication, increase knowledge, and manage hypertension. These techniques were employed in the capstone projects to teach Mr. Williamson how to regulate his blood pressure. Mr. Williamson should get a blood pressure cuff so he may monitor his blood pressure at home rather than just simply having it measured at checkups. We spoke about how to operate it properly and how important it is to calibrate it according to the manufacturer's instructions and recommendation to get accurate results. Due to his lack of health insurance, Mr. Williamson's funds are occasionally limited, especially when it comes to refill his medication. As a result, we talked about it. And we reviewed the Affordable Care Act, which is a legislation that provides better and more affordable health care to those with pre-existing conditions. I devised the low-cost therapies such as exercise, stress management techniques such as uh, breathing treatments, and DASH diet. By enabling him to be a part of his treatment and providing him with the authority that every patient deserves in their care, ethics played a role in developing my interventions. As a nurse, it is my role to design interventions that are simple to implement and listen to my patients to understand their position and reasons why they're not implementing them, and also educating them and supplying with resources when they need it. With this consideration in mind, I devised a strategy that's simple for Mr. Williamson to implement. And I gave him a pamphlet that he can easily refer to. It took a little more than 3 hours to complete this meeting. Mr. Williamson had a few questions to which I was able to respond using literature. He was open to suggestion and he believed they were simple to implement. He was amazed of how small adjustments in his lifestyles may have a big influence on his health. His wife also joined in a little bit of the conversation, saying that she's happy to see Mr. Williamson trying to make adjustments, and she will try to prepare meals that are accepted by the DASH diet. The capstone project went well, just the way I was hoping. From the first interaction I had with Mr. Williamson, it was clear that he required education on how to regulate his blood pressure at home. He required more information on basic intervention that make a significant impact, such as the significance medication adherence and strategies like setting reminders and utilizing pill boxes by the day of the week. Best practices were also presented, and Mr. Williamson was willing to make changes and do this to prevent his blood pressure. I'll monitor his blood pressure once a week to see if the treatments were effective, and I will keep track of the results in a diary. Unlike of most of my patients at work, who I don't see frequently, I'm able to keep a close check on him and analyze his development since he's a family friend. I learned a lot about new issues in nursing through the RN to BSN program, and I found myself setting higher expectations for myself and the care I give to my patients. And as I learn a lot about evidence based practice and QSEN efforts to increase patient safety and quality of care. Before beginning the program, I believed that BSN would be simply another qualification for increased job chances and that I would not be learning anything new. I must acknowledge that I was completely mistaken. Every class has expanded my understanding of what I gained during my associates and taught me something totally new, particularly regarding patient safety and the various duties that nurses have outside the bedside care. It provided me to me that I can make a difference not just in my patient's life, but also in healthcare. Now that I have new tools to help me thrive in my job, I will always use an evidence based practice approach to make the greatest decision for my patients. I want to keep reviewing evidence based material on a frequent basis to keep my treatment up to date and improve patient safety, satisfaction, and good results. I'm excited about being a baccalaureate prepared nurse and ultimately transferring into jobs that will improve the safety of my patient, such as being a member of a committee or taking on leadership duties, such as becoming a charge nurse. This curriculum has provided me with current information, which is important because at my employment location, I am responsible for training new nurses that join the team. I need to be well versed for the new nurses to be well versed to deliver good care. I intend to continue my education since in healthcare field education does not finish with graduation, but rather continues throughout our careers. I am grateful for the tools and information I gained from this program, and I want to put them in my practice. I appreciate Capellas and all the professors' help. Thank you very much.